All right, let's dive in. Today, we're going to look at a force that quietly directs some of the most personal parts of our lives, even when we don't see it: global health law. I mean, really think about that for a second. Who gets the final say on whether your most sensitive health data stays private? Or who decides if a certain treatment is mandatory? Or what you have to do to even qualify for a life-saving transplant? Well, the answer isn't always as simple as, say, your doctor. Nope. It's this huge, complex system of rules, regulations, and court cases. It's a powerful and, yeah, often invisible force that shapes health for every single one of us. And what we're talking about here has a name: global health law. Basically, it's this massive field where all the legal stuff, the laws, the international rules, smashes right into our fundamental human rights. And all of it works to shape health outcomes for everyone, everywhere. Okay, so to really get a handle on this whole thing, let's start at the most personal level possible. Let's start with you, the individual, and the laws that govern your body. At the very heart of global health law, you've got this constant push and pull. On one side, there's your individual freedom, your right to make choices about your own body. But on the other side, there's this need to protect the collective well-being, the health of the whole community. Balancing these two, that's the million-dollar question that lawmakers and courts are wrestling with every single day. And that tension, it isn't just some abstract idea. It gets very real, very fast. It's the legal reason behind things like compulsory treatments or involuntary commitment for someone having a mental health crisis. It's the foundation for vaccine mandates, and even for rules that say a patient has to prove they're abstinent to get a life-saving transplant. These are massive legal interventions, and they're all justified in the name of the greater good. And believe it or not, this legal reach goes beyond our own lives. Legal experts are now pushing to create a moral right to privacy for our health data, even after we're gone. The idea is to protect our digital legacy just as seriously as we protect our physical one. So let's build on that. We're going to zoom out from the individual to see how these laws play out for specific communities, especially for the folks who are most vulnerable. You see, the law can sometimes be a really blunt instrument. There are cases where public health acts, like one in Kerala, India, have been seriously criticized for pretty much ignoring human rights guidelines. And that creates a real risk that those laws could be misused against people who are already on the margins. It just goes to show you, good intentions don't always equal good outcomes. But, and this is a huge but, the law can also be an incredible engine for justice. It's got this dual role. Just look at India, where landmark court rulings use this idea of constitutional morality to protect and push forward the rights of the LGBTQIA+ community. And that wasn't just on paper. It led to actual real-world changes in mental health care. And this fight is far from over, not by a long shot. Right now, legal battles are being fought on so many fronts. For tribal nations just trying to get access to their own public health data, for activists fighting back against anti-equity laws, and for communities demanding that the legal system finally deal with the structural discrimination that causes so many health problems. Okay, let's widen that lens again. We're moving up to the national level now, where the choices made by governments and big agencies can send ripples all across the globe. Take a look at this number for a second. 29%. What in the world could that represent when we're talking about health law? Well, get this. That's the percentage of hospitals' ethics programs where a huge focus isn't on debating big moral questions, but on just trying to keep up with existing laws and regulations. So the takeaway here is that law isn't just some background noise, it's a massive day-to-day operational headache for healthcare. And what one country decides almost never stays within its own borders. So when the US FDA gives the green light to a major new technology, like a trial for genetically engineered mosquitoes, it doesn't just happen in a bubble. It basically sets a precedent, a global standard that other countries are going to look at and follow. So what happens when those national systems have huge gaps? During all the pressure of the recent pandemic, it came out that a major country like South Africa didn't even have a national council to oversee health research ethics. It exposed this massive vulnerability at the worst possible time.
All right, time for our final step back. We're going from the national level all the way out to the global view, looking at the kind of planetary health challenges that no single country can possibly solve on its own.
I mean, just think about the scale of the issues we're up against today. How do we manage health data that flows across borders in a split second? Who gets to regulate super powerful gene editing tech? How do we coordinate a legal response to climate change's health effects? Or make sure people's right to health is protected in the middle of a war? Yeah, national laws just don't cut it.
And this is exactly where international law has to step in. Organizations like the World Health Organization and human rights bodies, they provide the frameworks we need for global cooperation. They set the standards and build the legal structure we need to tackle these shared threats as one. So, after seeing the power and the problems with health law, from the individual all the way up to the entire planet, what's next? Where do we go from here if we really want to build a healthier world? Well, the future is all about creative, bold, legal thinking. Experts are looking at all these cool new pathways, using civil rights law to take on health disparities, applying ideas from disability justice, even trying to establish a legal right to a healthy environment. It's a huge shift, moving from just fixing problems to actually building a system where people and the planet can thrive together.
Which really leaves us with the ultimate question. The laws we write today are going to build the world we live in tomorrow. So how do we make sure that they're designed not just to manage sickness, but to actively create health and justice and equity for every single person on this planet?